Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department COVID-19 response. Today is Friday, March 27th, and this is my daily update. So here in Missoula, the number of cases that we have of COVID-19 are now at 8. As of this morning at 8 a.m., Montana has 108 cases, and last night Montana had its first COVID-related death. This person who passed was not a Missoula resident, but nonetheless, we want to share our deepest sympathies and condolences for their family, friends, and loved ones in this very trying time. Yesterday, Governor Bullock announced a stay-at-home order that goes into effect at 12:01 on Saturday, tomorrow. People are being asked to stay at home except for essential functions such as seeking medical care, getting groceries and supplies, taking care of others who need to stay at home, and if you work in an essential field. We've revamped our website at missoula.co/cvirus in order to make some information easier for you to find. There is a section about the governor's order, as well as resources for those that are at home and businesses that are trying to determine if they qualify as an essential service. We just want people in Missoula residents and businesses that are being affected by this order to know that we're thinking of you. Some of us here at the health department are also in the same similar situation as you. Speaking for myself, we are a small business owner also. I also have children who are being kept home from school that we're now homeschooling in the midst of all of this. So we definitely feel all of the same stress and pain that y'all are going through. So just know that we're all in this together. We hope that you can connect with our county emergency operations team that is facilitating our community resources and assistance during the COVID-19 outbreak. You can reach this group by calling 258-INFO and selecting option number 2. The governor's order will not affect our health department's COVID-19 response. We will still be able to serve the community, and those of us who can work from home will. Other essential functions at the health department are going to continue, and employees that can work from home are going to do so. The other thing that I want to cover today is testing. I know I've covered this a few times, but we're still getting a lot of questions, and there's a lot of misconceptions about what's actually happening in our community, about who's getting tested and why. So I want to just try to dispel some of the rumors and unease around that and give people a real sense of what's actually happening in our community in Missoula. We and our local providers want everyone tested who needs one. That would help us epidemiologically at public health to be able to really figure out, who's getting sick from this disease and, the demographics of it and how to better prevent it. However, despite some of what you might hear, there are times whenever testing supplies are running low, and healthcare providers just have to make decisions based on risk factors, severity of the illness, sensitive occupations, or potential exposures. When tests are readily available, they can test more people a little bit more freely without having to take other things into consideration. But the decision to test has nothing to do with how much money you make or that you aren't taking your illness seriously. It's actually about resources. Sometimes we just are not able to get the resources that we need, and it's not that the testing isn't available at the state level or at some of our other labs that are doing the testing. It's really about not being able to get the nasal swabs or the viral media or the saline tubes in order to transport that test to those testing labs. So if you're asked to stay at home for 14 days by a doctor, please do so regardless of whether you got tested. You don't want to spread the illness in the community, and if your symptoms become worse, it's really important that you do seek medical care in a safe way, which means calling ahead. In short, we and our healthcare providers want people to get tested. It helps inform our response, helps us keep a better pulse on what's actually happening in our community. But if the resources aren't there, we just need to make the best decisions that we can with what we have. These are unique times, and things right now are just really not optimal, but we do have hope that things are going to get better, that the testing supplies are going to start coming in, and that at some point, anyone who is having symptoms that are consistent with COVID-19 will be able to get a test. We're just not there yet. So please bear with us in public health, and please be respectful and bear with your healthcare provider if they say, I'm sorry, but you don't fit into a high-risk category, you don't work in a sensitive occupation, we really have to reserve our testing. You know, you may have it, so if you do, go home. If that's what they tell you, go home, try to treat your symptoms at home. It's not going to change the course of your treatment or the outcomes because there is no treatment available for COVID-19. So you just have to try and treat your symptoms and stay home until you're no longer contagious. And if you have any questions about whether or not you are contagious, if you've been told, we think you might have this and you need to go home, certainly give your healthcare provider a call, or you can call 258-INFO and get directed to one of our public health nurses that might be able to help you figure out at what point you are no longer contagious. So again, I just want to say thank you to our Missoula community for being cooperative and understanding in this super difficult time. And I guess that's it for my daily briefing for today. So everybody stay healthy, and I will talk to you on Monday unless something really big happens here over the weekend, and then I will definitely do an update at that time. Thank you.